When my mom opened her email, she wasn't expecting a diagnosis. The email just said, "Your labs indicate a thyroid disorder. I'm prescribing you medication. Let me know if you have any questions." That was it. No call, no explanation, just a prescription attached to a brief message. My mom had plenty of questions. What does this mean? Do I have symptoms? Will I need medication forever? Is this something very serious? But she hesitated to respond. If her doctor didn't take the time to explain, would he even care about her concerns? That moment showed me the impact of patient centered care, or in this case, the lack of it. Patient centered care is a healthcare approach that prioritizes communication, empathy, and shared decision making. It means listening to a patient's concerns, explaining diagnoses and treatment options clearly, and treating patients as partners in their care. When done right, it empowers patients to understand and manage their health with confidence, and without it, even a simple diagnosis can feel confusing, isolating, and overwhelming. Through my research lab, which is the Helios lab, I've been able to learn more about patient centered care in practice. In our projects, I work with patients at the UCI Family Health Center in Santa Ana, where I've helped patients fill out surveys to assess their chronic disease management and social determinants of health, conducted medication sorting and packaging for educational demos, and even assisted with wellness and nutrition phone calls. I've also helped lead educational presentations for Spanish speaking community members on topics like physical activity and diabetes management. For one of our projects focused on hypertension in the Latino community, we were able to add a short questionnaire about patient centered care, or PCC for short. We also collect data on whether or not patients are taking their blood pressure medication as prescribed, a concept called medication adherence. Putting these two together, I've been researching the question of whether PCC makes a difference and whether a patient is able to adhere to their blood pressure medications. To examine my research question, I used the PCC questionnaire to divide patients into two groups: patients reporting high levels of patient centered care from their doctors, and patients reporting low levels of patient centered care. Then I used another questionnaire called the Mariski Medication Adherence Survey to measure self reported medication adherence and classify each patient as adherent versus non adherent to their medications. I found that patients in the low PCC group were much more likely to be non adherent to their medications than patients in the high PCC group. These results highlight the critical role of strong patient-doctor relationships in ensuring patients feel heard, informed, and empowered in their healthcare decisions. If a simple conversation can make the difference between hesitation and adherence, then improving PCC isn't just important, it's necessary.